Hello, my name is Eric Denji, Executive Advisor in Sustainable Development and Performance at the Integrated Health and Social Services Center of the Outaouais. The center is a healthcare institution that offers general and long-term care, as well as community services. We are located in the Outaouais region in the province of Quebec. Our institution has close to 10,000 employees and is spread throughout the Outaouais region in urban and semi-urban areas. Our project covers 44 facilities. The title of the project is the Plan for Prioritization of Adaptation Measures for the Facilities of the Integrated Health and Social Services Center of the Outaouais. The project is divided into 5 components. The first was to assess and to draw up a description of the climate risks in the Outaouais region. In other words, to be able to know which hazards our population are exposed to. The second was to assess our population's vulnerability to climate change from a health perspective. The third was to assess the vulnerability of our infrastructure, the 44 facilities, to climate change. The fourth was to see what our response capacity is as an institution if we were faced with natural disasters. Lastly, what we wanted to do was to try to see through all this information received what adaptation measures we should prioritize for our facilities in the Outaouais region.
We decided to involve several stakeholders. Some government institutions were also involved, including the Institut national de santé publique du Québec, the Ministère de la Santé et des Services sociaux, and the Société québécoise des infrastructures. We also worked with the City of Gatineau and the 4 regional county municipalities in the Outaouais region. We also worked with the Outaouais Regional Civil Security Organization, which is under the authority of the Ministère de la Sécurité publique. We also worked with the Université de Québec en Outaouais and the Université de Québec à Montréal, as well as with the Observatoire du Développement de l'Outaouais, and we work with the Conseil régional d'environnement et du développement durable en Outaouais, which is an environmental organization in the region. Lastly, we hired external consultants to help us, basically to assess the risk of climate change by creating a description of the situation in our region and by assessing the risk to infrastructure and also the civil security measures.
This project allowed us to develop knowledge on the different vulnerabilities related to climate change. It also enabled the establishment of mechanisms and tools for the consideration of climate change adaptation in clinical and operational activities. This project also helped us mobilize the various stakeholders in the region on climate change issues and allowed us to improve the collaboration we had with our various partners.
Of course, there was the challenge of the COVID-19 pandemic, which meant that some of the resources involved in the HealthADAPT project had to be assigned to tasks associated with the pandemic, at least temporarily. That was a pretty big challenge. Because of this alone, personnel who worked on this project were not regularly available. That complicated things a bit. The other point that was a bit of a challenge was that, still in connection with COVID, we had to make sure that the video conference meetings were interactive and friendly in an effort to rally the partners around us. We are proud of several achievements in our project. First, we were able to involve a good number of internal and external partners in the context of a pandemic. That improved collaboration around climate change adaptation. It also allowed us to develop a project that integrates scientific knowledge as well as knowledge from the field and therefore considers the particularities of our territory and our local health networks. We also succeeded in mapping relevant climate, health, and social indicators with the support of the Observatoire du Développement de l'Outaouais, and in developing the team's ability to handle this type of data in the future. We also succeeded in providing our organization with a plan to adapt its infrastructure to climate change, with consideration for the population's vulnerability from a health perspective. It also made it possible to develop a better understanding of vulnerability to climate change. The project also made a few gains along the way, including securing funding for reducing heat islands, as well as relocating a site intended for a long-term care facility that was originally planned in a flood risk area.
Funding from Health Canada allowed us to hire a resource dedicated to coordinating the HealthADAPT project. It also allowed us to benefit from the support of several external consultants in engineering, civil security, geography, and environment. This was first used to assess the vulnerability of the built environment. our infrastructure, and then for the assessment of our emergency preparedness in the context of climate change. Lastly, the budget allowed us, thanks to the collaboration of the dedicated person, to develop a dynamic mapping tool representing the different vulnerabilities to climate change on our territory.
The impacts of this project on climate change are, first of all, that it has allowed us to have a better knowledge of the climate risk and the health risk, not only for our decision-making bodies in the organization, but also for our municipal partners and the various cities on our territory. It has also allowed us to consider the climate risk and all things adaptation in the development of projects concerning our infrastructure, whether now or in the future. It also allowed us to improve our organization's preparedness and the emergency response capacity of our various departments, and it was also a lever for obtaining funding to implement adaptation and mitigation measures within our organization. The continuation of the CISSSO project planned within the actions of the Ministère de la Santé is to continue, with the other regions of Quebec, implementing the methodology developed by the CISSSO to make the territories in Quebec resilient to the face of climate change. This implementation could be done by 2026 with the help of funding under the Plan for a Green Economy. By 2030, we hope to have improved the resilience of Quebec's real estate and population in the face of climate change. I also think it's important to seek commitment from key players within our institution from the start. In Quebec, public health is a part of the Réseau Régional de la Santé et des Services Sociaux. We took the opportunity to engage the department that's responsible for technical services and logistics for all health network facilities. This allowed us to include in the project a focus on the built environment and on the health network's emergency measures. Then, with the technical and logistical services department, we sought the commitment of senior management before starting the project. One of the winning conditions for implementing climate change work is to have a project coordinator, one who is ideally dedicated at least part-time during the period required to carry out the project. It's also necessary to ensure the availability of stakeholders to participate in the work. So we, in our project, the coordinator played a leadership role that was essential to the implementation of the project and worked with stakeholders who were assembled. I would also say that ideally a group of stakeholders brought together should have a fairly diverse, multidisciplinary profile, which is also necessary for climate change work. It also helps to know external partners who have an interest in climate change or who have climate change expertise and know-how. It's important not to hesitate to include them very early in the project process, from the planning stage onward. To sustain internal and external mobilization, I also suggest trying to make short-term gains within the project. In our project, we had the chance to do some of these things, including managing to influence the location of a residential and long-term care center to prevent it from being placed for a second time on land at risk of major flooding.